So in our current study, we examined 10 time periods, 1999 to 2000 and up to 2017 to 2018, and assessed the NHANES data bank, which is almost 20,000 participants, for the prevalence of BMI criteria for body composition, underweight, normal weight, overweight, and obese. And we examined the cardiometabolic factors that make up the metabolic syndrome. I'm Dr. Carl Chip Levy. I'm Medical Director of Cardiac Rehabilitation and Preventive Cardiology and the Director of the Exercise Laboratories here at the John Ochsner Heart and Vascular Institute, Ochsner Clinical School, the University of Queensland School of Medicine here in New Orleans, Louisiana. And I also happen to be one of the associate editors and the cardiovascular section editor of the Mayo Clinic Proceedings. But I'm here today to discuss one of our new papers entitled Trends in Metabolic Phenotypes According to Body Mass Index Among U.S. Adults 1999 to 2018, which will be published in an upcoming issue of the Mayo Clinic Proceedings. I'd first like to thank and congratulate the first and lead author, Jin-Sui Lee, or Juju, from the Department of Population Health Sciences and Policy at Icahn School of Medicine at Mount Sinai, New York, and her colleagues and co-authors for their excellent work on this paper. I also thank them for including me in this very important research. I just happened to find out recently that I was named the leader of the world by expertscape.com in the topic of obesity. And this is probably one of my bigger papers on the topic, no pun intended, in recent times. I think it's a very, very important paper. I think most people realized that obesity has been increasing in epidemic proportions in the United States and really most of the Western world. And now overweight and obesity accounts for 75% of the US adults. 42% make the criteria for obesity by BMI criteria. And I think what's even more alarming is the fact that severe or class 3 obesity, which is BMI over 40, is now present in 9% of our population, basically 1 in 11 adults. And obesity worsens almost all of the cardiovascular risk factors. It raises blood pressure and leads to hypertension. It worsens the lipids, particularly raising the triglycerides and lowering the cardioprotective HDL cholesterol. It increases blood glucose that leads to metabolic syndrome and diabetes. It increases inflammation. And really almost all cardiovascular diseases are increased with obesity. But I think that there's evidence that cardiometabolic factors that make up the metabolic syndrome probably play an even more important role than weight per se in at least atherosclerosis. As we showed in figure 1 of this paper, that basically over time, the prevalence of metabolic syndrome in the classes of BMI, underweight, normal weight, overweight, and obese, stayed about the same. In underweight, the prevalence of metabolic syndrome is about 4%. In normal weight, it's about 9%. In overweight, it's about 34%. And in the obese, about 63%. But we demonstrated in this study that not only did the BMI categories increase over time, so much more overweightness and obesity, but also metabolic unhealthiness significantly increased over time as well. The number in the normal weight category significantly decreased, and this is true for both metabolically healthy and metabolically unhealthy, and the prevalence of obesity markedly increased, both metabolic healthy and metabolically unhealthy because of increases in BMI in the population. The prevalence of metabolically unhealthy obese increased in almost every subgroup that we studied, but this was particularly noted in the older individuals and those with lower socioeconomic status and less education, more so than in the other groups. I think this is very important because really we know that all cardiovascular disease increases with obesity, but the atherosclerotic diseases, coronary heart disease and stroke, particularly increase with metabolic unhealthiness and the metabolic syndrome more so than weight per se. Now, for heart failure and atrial fibrillation, weight probably plays a more important factor. Now, for the individual factors, the ones that really increased over time was the waist circumference and the glucose, more so than the triglyceride factor, the low HDL factor, and the blood pressure factor. Now, we showed in this data that the group that had the highest amount of normal weight and metabolic unhealthiness was the older individuals, but the group who had the normal weight, metabolically healthy, were more likely the younger, the women, non-Hispanic whites, and those with higher income and higher education. And this was more important than gender, race, and ethnicity in this factor. Now, many other studies have shown that obesity has increased, but I think the important thing about our study in this representative sample of adults in the United States, that we also demonstrated the significant increase in the metabolic syndrome and metabolic unhealthiness, which I don't think has been described in this way elsewhere. Now, our study has many strengths based on a very large nationwide cohort in a large sample that's been very well studied over time. The limitation of our study is the fact that we did not really assess physical activity and cardiorespiratory fitness or muscular fitness in this study, which are all very important. And this study was not designed to assess major cardiac events. But in conclusion, our study demonstrated not only a very significant increase in overweightness and obesity over time in this large US sample, but we also demonstrated very significant increases in metabolic syndrome and metabolic unhealthiness, which is probably going to particularly put the population at risk of atherosclerosis, as well as other cardiovascular disease events like heart failure and atrial fibrillation. The clinicians need to really focus on getting the population more physically active and increasing the degrees of cardiorespiratory fitness, which would go a long way for preventing further weight gain in adults and also preventing the metabolic unhealthiness that has occurred over time, and at the same time would improve the fitness that is a very important predictor of subsequent prognosis, even if one is not perfect weight. Thank you very much, and I hope this information is helpful.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.